So let me ask you a question. What if the symptoms you're dealing with, the fatigue, the brain fog, the joint pain, the digestive issues, aren't just random and they're not just stress? And they're not something that you have to wait years and years and years on end to finally get diagnosed. Just sit with that for a minute. My name is Dr. Seth Osgood, founder of Grassroots Functional Medicine. What if your immune system has actually been sending you warning signals for a long time and no one has ever been able to explain what those signals actually mean? Because that's what I see at our clinic day in and day out. Today I wanted to explain something I'm very passionate about, autoimmune disease, and I want to explain it in a way that people have never explained it, including why it's exploding right now, why so many people are dismissed for years and years, and what your immune system is actually trying to tell you, because that is something you really need to listen to. And I want to be clear up front, this is not fear-based. It's not doom and gloom. I'm not trying to scare anybody. What I'm trying to do is bring you some clarity. Autoimmune disease affects nearly 50 million people in the United States alone. Let that number sink in, 50 million people. Globally, we're talking about 5 to 8% of the population, and that number continues to climb. And here's something that most people don't realize, and honestly, this part still surprises people when they hear about it. Autoimmune disease is one of the leading causes of disability and early death in women under the ages of 65. Yet most people don't hear about autoimmune disease until after they've been struggling for several years. Why is this the case? Well, it's because autoimmune diseases almost never start with a diagnosis. It starts with symptoms that don't fit into a tight diagnostic box. And this is really, really important. Most patients don't walk into my office saying, I think I have an autoimmune disease. They come into the office and they say things like, I'm exhausted all of the time, no matter how much I sleep, or my labs keep coming back normal, but I feel absolutely awful. I've seen multiple doctors and multiple specialists and I still have zero answers. And everybody keeps telling me that I just need to manage my stress. And if that sounds familiar, you're not alone. Here's the part most people don't get told. For many autoimmune conditions, the average delay from symptoms to diagnosis is 5 to 10 years. 5 to 10 years to actually get a diagnosis. And during that time, and this really matters, the immune system isn't just waiting around. It's actively adapting, often in the wrong direction. So let's be really clear about something up front, because this is where a lot of confusion starts. Autoimmune disease is not your immune system being too strong. It's not your body randomly attacking itself, and it's definitely not bad luck. Autoimmune disease is a loss of immune tolerance. Your immune system's job isn't just to fight infections, it also has to know what belongs to you. When that recognition system breaks down, the immune system gets confused. A useful way I think about this, and I use this analogy a lot, is that facial recognition software, something we all see a lot of these days. If a security system starts misidentifying similar faces and familiar faces as threats, the problem isn't aggression, the problem is misidentification, and that's autoimmunity. And here's the key point, so don't miss this. Suppressing a confused immune system without fixing the misidentification doesn't restore your health. It just quiets the alarm. Now, this is where antibodies come into play, and this is also a critical piece. Antibodies are not benign findings. They are immune tagged, signals that your immune system has identified something as a target. And the research is very clear on this. Autoantibodies, the ones your doctor doesn't like to test, often appear years, sometimes decades before autoimmune diseases get diagnosed. Yet patients are routinely told things like, your antibodies are insignificant. Lots of people have a positive ANA, and we're just going to watch these. For an immune system standpoint, and this is important, that doesn't actually make a lot of sense. The immune system doesn't casually just make antibodies. Persistent antibodies mean immune tolerance has already been lost, even if a tissue has not been damaged yet. Now, that doesn't mean you automatically have a diagnosis, but it does mean your immune system is waving a red flag. And not all antibodies mean the same thing. This is where nuance matters. There's different antibodies. IgM antibodies often suggest that there's an early or acute immune activation. IgG antibodies reflect immune memory and persistence. And IgA antibodies often point towards a gut or mucosal immune involvement. What really matters isn't just whether an antibody is positive, it's the persistence piece. It trends over time. It's expansion of antibody patterns. Long-term studies show that antibody evolution is strongly associated with future disease. So this is really about trajectory, not labels. And this is usually the moment where people say, okay, this finally explains what I've been experiencing, because autoimmune disease doesn't happen all at once. It unfolds in stages. In the first stage, antibodies are present, but symptoms may be minimal or even absent. Immune tolerance has already been lost, but tissue damage hasn't occurred. In the second stage, and this is called reactivity, this is where people start to have symptoms. The symptoms start to show up. You'll get fatigued, you'll get pain, you'll get digestive issues, brain fog, but labs still may be considered normal. And this is the most commonly missed stage and the most actionable. This is where you want to jump in and get started with some lifestyle changes. And then there's the third stage where the immune attack becomes sustained. Tissue damage is measurable, a diagnosis finally sticks, and treatment usually focuses on immune suppression. And here's the big takeaway. Autoimmune disease doesn't start at diagnosis. It starts when tolerance is lost, and that moment is often missed. And so now let's talk briefly about genetics and why this affects women so disproportionately. Yes, genetics absolutely do matter. We always say that genetics load the gun and the environment pulls the trigger. That's why identical twins don't always develop the same autoimmune diseases. And this also helps explain why roughly 75% of autoimmune patients are women. Women's immune systems are more dynamically regulated, especially during hormonal transitions like postpartum and perimenopause, and that sensitivity is extremely powerful. But in a modern world full of immune stressors, it also increases vulnerability and dysregulation. And that brings us to why autoimmune disease is exploding right now. Our immune systems evolved in a very different environment. Today, we're dealing with ultra-processed foods, chronic infections, disrupted microbiomes, environmental toxins, and constant psychological stress. These factors drive the immune confusion through mechanisms like molecular mimicry and increased gut permeability. And once you see this, once you really understand it, you realize this isn't random at all. It's actually pretty predictable. So why does conventional medicine miss this so often? It's because conventional medicine is absolutely phenomenal when it comes to late stage disease. It's less equipped to recognize early immune dysregulation. Diagnosis often requires tissue damage. That's stage 3 of autoimmunity. Treatment focuses on suppression, not restoring immune tolerance. That's not malpractice, it's a limitation of the model. If you've been listening to this thinking, this finally makes sense, the next step isn't to panic. There's so much you can do. It's education. Autoimmune disease is complex, but it is understandable. That's why we built the Grassroots Knowledge Hub, a place to learn how autoimmune disease actually develops, what labs really mean, and why early immune signals matter. And if you want a deeper, more structured framework, we also offer autoimmune masterclasses to walk you through all of the different steps. Education always comes first. Clarity comes before action. And if after educating yourself, you feel ready for clarity through testing and a structured path that looks for root causes, not just symptom control, that's where you need to schedule a discovery call with our clinic at Grassroots Functional Medicine. This is not a sales call. It's a clinical conversation to determine whether our approach is appropriate for you. And that's all we want. We want patients who are ready to go and ready to take action. My name is Dr. Seth Osgood, founder of Grassroots Functional Medicine. I built this clinic because I've lived this experience personally and alongside thousands of patients who were told to wait, manage their symptoms, or just accept uncertainty. We don't chase labels. In fact, most of the time, I don't even care what your label is. We look for mechanisms. We use data to create clarity, and we focus on the root causes, not temporary fixes. So if you're ready to stop managing your symptoms and you want to start understanding why your body is doing what it's doing, we would be honored to have that conversation. Autoimmune disease is not your body betraying you. This is a misconception that a lot of people end up feeling when they're going through this. It's your immune system responding to a world that it was never designed for, without the guidance it needs. And when the signals are recognized early, outcomes will change. Thank you guys so much for watching. I hope you found this helpful. Have a blessed day.